advanced non-small cell lung cancer is still a very serious disease. But for certain subgroups of patients, we are seeing long-term control of the disease. So we're moving from this binary choice. You know, you're alive and cured, or you're dead. And there is a middle ground where you are living in harmony with your cancer, and it is controlled in the same way like some other chronic diseases like diabetes or asthma might be. And for example, with ALK-positive lung cancer, we now have people living, at least the recent series from our center, nearly 7 years as a median. That means many people are living longer than that. In terms of the therapies for non-small cell lung cancer, we really can split it into two broad categories. So we have the standard ones which are going to apply to pretty much everybody. So some kinds of chemotherapy, some kinds of immunotherapy. And then we have individual pathways for defined molecular subtypes of lung cancer. There are now 5 FDA-approved molecular-specific subtypes with approved targeted therapies. That's EGFR, ALK, ROS, BRAF V600E, and NTRK gene rearrangements. But there's also a range of other molecular abnormalities that there are drugs, certainly in trials, which are looking very active, and no doubt these are looking for FDA licenses, or you could send patients for clinical trials, and that would include MET exon 14 skip mutations, high-level MET amplification, HER2 mutations, EGFR exon 20 insertions, to name a few. BRAF mutations are most well described in melanoma, but they also occur in lung cancer, particularly BRAF V600E, which is about 50% of the mutations that it's about 50% of the BRAF mutations in lung cancer, and only about 2% of lung cancer has BRAF mutations. The other ones are a range of different mutations, most of which we don't know what to do. So they're traditionally called non-V600E mutations. We saw some data at ASCO 2019, maybe some provocative cell line data. They might respond to MEK inhibition, but I think they're very much a work in progress. What we do know, and we know what to do, is when you have one of those V600E mutations, and as I said, that's about 2% of lung cancer. BRAF V600E mutation is a classic abnormality. It locks a kinase in an active conformation, and signaling through BRAF, it goes RAS, RAF, MEK, ERK, and so it's part of the proliferation pathway. And so the goal is to inhibit it. And the initial drugs were BRAF inhibitors, and they certainly can work, but they have about a 30% response rate. What it turned out was that there was a feedback pathway which limited their activity, and you could block that if you also gave a MEK inhibitor in combination. So what you now find is the licensed treatment in lung cancer as of 2017 is a combination of dabrafenib, which is a BRAF inhibitor, and trametinib, which is a MEK inhibitor.